Hello, everyone. Today, I'd like to talk to you about blockchain and then get a little bit more specific and talk to you about blockchain in the healthcare space. If you'd like to access this demo and this presentation, there will be a link provided for you. There, you can also access it through this link here as well. Also, throughout the app, you will see this mouse icon. If you click on it, it will take you to additional information on any specific topic that we might be speaking about. So I have one major goal around this presentation, that is blockchain adoption and education around the blockchain space. Today I'd like to speak about blockchain in a broad general sense and through the lens of an app developer in the healthcare space, and not so much get into the technical details. So I'm going to provide some general information and then provide a demo. And remember that you do have access to this demo as well, and the link will be up here at the top right corner for the remainder of the presentation. So blockchain is kind of in a strange place. It's a new technology, and the use cases that we're kind of used to seeing are either very, very ambitious or something that we don't really understand. But today I'd like to attempt to clear that up a little bit. So most of you may have heard about Bitcoin. What I'd like to briefly speak about is Ethereum, which is a similar but a different project. The key difference is that these are the developers that coined the term smart contract. A smart contract is simply just an application. When we write iPhone apps, we call them iOS apps that we run on iPhones. When we write blockchain apps, these are called smart contracts or decentralized apps that run on a blockchain network. If we have an application, that means that we need an environment to run this app. We can't just run it in thin air. The Ethereum network provides us with a virtual computer, and virtual computers are nothing new in computer science or in our daily lives. The key difference is that this virtual computer runs on the blockchain, meaning everything we do in this virtual computer is saved to the blockchain, and we can't change or edit anything without someone else knowing about it. The virtual computer is maintained by the miners. If you are familiar with Bitcoin mining at all, this is that process, very similar. Miners are literally providing the electricity and computing power for this virtual network, this virtual computer. And the blockchain keeps tabs on what everyone is doing on the network. With that said, we kind of create a two-tier system. We create the value providers and the infrastructure providers. The value providers are writing apps and giving the network value for the users. It isn't enough just to have a coin. You need a useful product for people to use. The infrastructure providers are the ones putting up the electricity to keep the network running. The key takeaway here and any blockchain project is that both sides must see value in the network, and everyone in the network needs to see value in that network. Otherwise, why would they contribute to the network or be part of this network at all? So let's take a step back and look at some key differences between a private blockchain and a public blockchain. What we just talked about is Ethereum, which is a public blockchain. These usually offer a coin, are open to all. They're still innovative, and the two big examples are Bitcoin or Ethereum, but there are hundreds and hundreds more. The other type of blockchain is a consortium blockchain or a partnership blockchain, where like-minded individuals and businesses come together because they want to create and foster a deeper relationship with their business partners or customers or anyone that they might interact with. Again, I'd like to stress that even in this blockchain environment, in a business environment, everyone involved has to benefit and see value from the network. Otherwise, why would they fund it and why would they contribute to it if they see no value? And the key difference here, kind of against the traditional technology, is interoperability. The data is secure. You can have permission to certain data points and then tie that data to your existing business infrastructure. It is not enough, or it is not a mission for blockchain to replace existing applications or existing business processes. And I think that's the wrong kind of route to take blockchain if that's kind of the mission. The mission for blockchain, as I see it, is a use case to kind of augment and further enhance current business processes and current system. We're not kind of speaking to replacing current systems because they work. These are the systems that kind of get us through our day-to-day lives. So why would we come in, root them out, and replace them? And what blockchain kind of wants to do, or fosters to do, or should do, is kind of augment these systems to make these systems run smoother, have more information available to it, and just kind of run better in a general sense that we kind of can't currently do. Some benefits from a private blockchain is that we have permissioned access. So who we let into this network to contribute will need permission, whereas in an open blockchain, anyone can kind of join in. And in a private blockchain, these are usually written in Hyperledger. Hyperledger is a blockchain technology for business applications and business networks. It takes the good things about public blockchains and the technology as a whole and leaves out all the negatives, like mining, which slows the network down. So these networks tend to be a little bit faster. So let's tie this back to healthcare. Moving forward into the consortium space, we can tie it back what we talked about. So we still have a two-tier system of infrastructure providers and value providers. Here we can have healthcare applications which run on this virtual healthcare app store. The infrastructure is the hardware and the electricity put in place for the healthcare app store. App developers can then use this environment to create valuable applications for patients, researchers, hospitals. Participating parties must see value in contributing to this network. And this value doesn't necessarily have to be financial, but it could be. A researcher could see value in this network because they need data, and that data is there. Let's talk a little bit more about that. So if you're a hospital, a manufacturer, or a researcher, you might see value in this network because of the access to patients on the network. If you're a software developer, you might see value in this network because there's a user base to capture for your idea that you would like to develop. If you're a family doctor, you could see value in this network because you have more insight into your patients. As a patient, I see value in this network because I finally have somewhere where I can go for my information. As it stands right now, I own all my medical data, but I have no access to it. So if I go to any doctor or have any procedure done, if I go to another doctor, I physically have to go to the previous doctor, get my medical records, and then physically move them to the next doctor. This really should be autonomous. So let's take a look at a demo. So here we can kind of look through the lens of kind of a story. This story is being told through Jen. So Jen heard about a new medicine tracker app which helps her track her dosage. Jen is a type 1 diabetic with an insulin pump. Taking and measuring the correct insulin dosage is kind of a way of life for Jen. Whenever Jen takes medication, she uses her medicine tracker app. The data can be inserted through an iPhone app, or it can be connected to her pump for ease. When data is entered into the app, it is written to the blockchain, and because of this, multiple parties are kind of happy. Jen is happy because she has an easy way to track her insulin intake and blood sugar levels. Jen's doctor is happy because of the care they provide is more tailored to Jen because they have access to this data. The pump manufacturer is happy because they can request to pull Jen's usage data and run research on it. Researchers are happy because they can request Jen opt-in studies or request her data. Hospitals benefit because they have Jen's information should an emergency come up and Jen is unresponsive. So here we can create a new patient. Let's call this patient Tom. Emergency contact is Tom's dad. So now we have a new patient created in the blockchain, and let's say Tom now wants to edit or enter information within the blockchain. Let's assume Tom is also a type 1 diabetic and he is self-medicating for whatever medication he might be taking. So when we click on the self-medication button, Tom is sending a notification to the back-end blockchain service and saying, hey, I've taken this medication, just keep tabs on it for me. Let's say Tom is also at the doctor's office, and over there he's also taking medication as well. And the same thing here. And all the app does is just keeping a log of Tom that anyone can come in and have access to. Let's assume Tom is also going to the hospital and he's taking information or taking medication as well, or assuming that the IoT pump is also inserting data for Tom as well. So here we can kind of see the data going into the blockchain network. So we have a transaction ID, we have the location of where this data comes through, and just kind of any notes or might be happening. And now we can kind of get into the demo, and let's just see what Tom's information looks like. So here we have Tom's information. Tom currently has no conditions or allergies or anything like that. But here at the bottom, we have a track record of Tom's medication, all the medication that Tom has taken throughout here, any refills, memos, the pharmacy which he took at the doctor. So here we go back to that researcher hospital medical center scenario. Tom can then tell them about this network that he's contributing to, and then they can pull his records in automatically. So this has been the demo and the presentation. If you'd like to have some more information, please feel free to reach out.